actually have all the arguments, some very strong arguments against privatisation and why we need to restore an NHS, a public NHS. It makes absolute sense. It's not just an emotional thing, it's actually, it's totally rational. And talking about rational, we now have Mark Thomas of the 99% organisation, who is the author of the Rational Policymaker's Guide to the NHS, which is available on the internet. You can order it on the internet. And his talk is entitled, "If the NHS fails, the economy fails."
Thank you very much. I shouldn't claim to be the author of the report. I was one of the authors of the report. 99% of organisations, for those who don't know, is an all-volunteer group of about 4,000 people. So we don't have a single employee, and we have virtually therefore no income, no expenditure. But when there's something really important, some of those 4,000 people say that they want to get involved and try to do something about it. And when the government put together what was originally the white paper for the health and care bill, we became very concerned, and a lot of our members became very concerned, and we worked together with our members and indeed with members from KONP and NHP and some other organisations to originally to campaign against it, but then having failed to stop the bill, we said, well, okay, let's stop being negative and defensive, let's be positive, let us paint a picture of what a rational government would do. Now, of course, this government didn't listen, but we might be about to have a change of government. So John talked about rationality, and that's what we tried to do in this report. So here is a physical copy, which I don't have very many of, but if you look on the 99% website, you can download the PDF. It's not, you don't have to pay for it, it's free of charge, and it is actually a useful resource. As you can see, it's quite a big report. It's about 80 pages, and I've got 10 minutes, so I'm not going to be able to cover all 80 pages. Unfortunately, a wee bit more, that's very good. But I'll briefly tell you what the report covers, and I'll focus on one of the things that it covers. So what we said was, imagine that you were not just a rational policymaker, but very specifically a rational policymaker who had just been given the job of charting the future course for the NHS. How would you go about deciding to do that? And we said, well, you'd probably begin by asking yourself three questions. First of all, what works in practice? There are about 200 countries in the world. They all have different systems. Which ones work? Secondly, well, something's clearly gone wrong in the NHS. What is the root cause of that problem? And thirdly, we keep hearing that, with a growing and aging population, the NHS is unsustainable in its current form. Is that true? Those would probably be the three questions that you would ask. The answer to the first one I won't really talk about, but it is, John's already alluded to it. When the NHS was properly funded, it was quite regularly rated by the Commonwealth Fund, among others, as the best healthcare system in the world in terms of its combination of equity, efficiency, and effectiveness in producing healthcare outputs. We've never had the best outcomes in the country, in the UK, because we have a context of very high levels of poverty and deprivation relative to other countries. So the outcomes have never been the best, but the outputs from the NHS were regularly rated the best in the world. So the answer to your first question would be, well, the pre-underfunded NHS is the best model, and that would be a very interesting starting point for a rational policymaker. The second question, what went wrong? You know that, so I'm not going to spend any time on it, but the principal cause was that funding has simply not kept pace with need. Which brings us on to the third question. is it sustainable? We keep hearing it's not sustainable, and if it's not sustainable, then it sounds very responsible, doesn't it, to stand there as Sajid Javid did and say, well, somebody's got to be the grown-up in the room and be prepared to take the difficult decisions. It's just not sustainable to carry on with the NHS. Actually, when you realise that the NHS is more efficient than all the other systems, it does mean if we can't afford the NHS, we can't afford any healthcare system, which is in itself quite an interesting thing. I think more journalists should put to him, where's the extra money going to come from if you're going to change model. But nevertheless, it's still worth looking at this question, because if it's not sustainable, if we are storing up problems for the future, we should know about it. So we decided to look at the interaction between the healthcare system and the wider economy, and that's actually, of course, quite a difficult thing to do, because the healthcare system itself is very complex. We just heard John talk about ophthalmology, which is a tiny bit of that healthcare system, but that healthcare system itself sits within an even bigger, more complex system, which is the economy. So we decided just to focus on the interactions. Next slide, please. So the economy is driven by people. Very specifically, it's driven by healthy people of working age. And if you've got unhealthy people of working age, but you can successfully treat them, you end up with more healthy people of working age, and that enables you to grow your economy. In order to do more treatments, you need more capacity nurses and hospital beds, etc. So you need more funding. And in order to do the funding, you need a well-performing economy. So what we've actually got there is a self-reinforcing circle. That's a loop of logic, if you like, which exists in the real world. So if you're a rational policymaker, you can't say, well, I don't really like the look of this, I'll just ignore that bit. That doesn't work. It doesn't remove it from the real world. But that's not the only one. There are several other important loops. Next slide, please. So I'm just going to squish this over. That's the same thing that you saw before. You can't quite see it now, but it's the same squished down to make room for a couple more loops. So next slide, please. The next one is what we call the poverty loop. So I'm sure you're all very familiar with the work of Sir Michael Marmot and among others on the social determinants of ill health. And what that shows is that if you have deprivation, that affects what in short we call lifestyle factors. That's things like diet, housing, stress levels, etc. And if those things are working against you, then you're more likely to fall ill, and you're more likely to need more treatment, which means you're likely to drop out of the healthy population, and you're going to reduce the economy, the growth in the economy. And so that also is a self-reinforcing cycle. And when you've got a self-reinforcing cycle, what that means is, depending on which way it's going, it's either a virtuous circle or it's a vicious circle. At the moment, it's a vicious circle. We've got increasing poverty, and that means we've got increasing numbers of people falling ill due to lifestyle factors, and that reduces the health of the population, and that's already reducing the strength of the economy. So again, if you're a rational policymaker, one thing you wouldn't do is to say, well, I don't like the look of this, so I'm going to ignore it. Next slide, please. And then we've got prevention. What we know is that if it's well targeted and up to a point, every time you spend £1 on prevention, you can reduce at least £4 of cure. So I'm not going to trace it all the way through, you can see how it works. But again, what you basically get is that the more you spend on prevention, the better the lifestyle factors get, and the less you need to treat, and the less funding you need. So it makes it easier to fund. So all of these things, those three loops, are self-reinforcing cycles. All of them, if you get it right, if you are a rational policymaker and you say we're going to focus on this, you can create, all of those can become virtuous circles. But if not, and right now the answer is not, then you've got three very powerful vicious circles at work. Next slide. And there's one more which we didn't model. We built a model of those that I put in colour. This last one we call the overload cycle. So when you've got too few staff trying to cope with too much work, they become overloaded. That affects morale and retention. If you also underpay them, that also affects morale and retention. And that affects attrition, which reduces your capacity and increases the overload. So you've got yet another vicious or virtuous circle, but currently very clearly in the vicious mode. So if you were a rational policymaker, or indeed if you were HM Treasury, you shouldn't say, well, we're going to ignore these things. You should say, we have to understand these things somehow. There's a discipline called system dynamics, which enables you to look at these things, and we use that just on the coloured bits of this diagram here to assess what the impact was going to be. So have the next slide, please. So this one is just to indicate why you would not be rational if you decided to ignore it. So the thick red line is really the only one that we need to focus on, which is the number of inactive people due to long-term ill health. There are other reasons why people drop out of the jobs market, but as you can see, that red line is the number who dropped out from long-term ill health. And what you can see is when we last had our waiting lists, it shot up, and again, it's shooting up. In the middle, it was actually declining, but now we put it clearly, firmly into vicious circle territory. And so this is about 2.8, 2.9 million people of working age who have already dropped out of the workforce due to ill health. You can see it's shooting up. You can see that's not sustainable. So let me just, the next slide, please. So if we try and think about what that means for the economy, the green line at the top, at about 3.8 trillion, that's what the OECD says that our GDP should be in the year 2060. They do forecasts for every country, and that's what they say UK GDP should be able to reach. The flat greyish line here, that's what it is today. And what we've modelled, what those lines indicate, is what would happen if you had different policies for funding the NHS. The revealed policy of this current government is to keep reducing the percentage of GDP that you spend on healthcare. And what this says, well, if you keep reducing it, we're currently around that, where those two lines cross. We could actually end up in a position, if they were to remain in office and continue with this policy, where there's zero growth between now and 2060 in the economy. So not only would that be an extraordinary moral and healthcare failure, it would also be demonstrably an economic failure, unheard of actually in the last couple of centuries, to have a period of that length without economic growth. So what we can see is that current policy is unsustainable. We haven't really looked at what would a rational policy look like. So that's the last thing that we modelled. That's okay. Have the next slide, please. So this top line is modelling a scenario where we assume that NHS funding does keep pace with need. So it's true, we do have a growing population, we do have an ageing population. We also have, at the moment, an explosion of various epidemics, obesity-related diseases, mental health, long COVID, etc. So funding in relation to need, spending the proceeds of economic growth on poverty reduction and increased spending on prevention, that will produce a spending requirement which looks something like this. It will spike up very, very sharply. And actually that happened after 1997. The spending on the NHS spiked up very sharply because capacity was too low, and when that happens, you end up with a kind of double demand. You've got the people who fall ill this year, but you've also got everybody that you've left on the waiting list because you didn't have the capacity before. So you've got a kind of illusory demand, but it's not illusory for those people, which you have to tackle first. And once that's out of the way, then you start to see a steady state, which actually, if you've got reasonable economic growth, there's nothing in our model to suggest that you would need to be spending an increasing percentage of GDP over the long term. So actually, there is an unsustainability problem, but it's not the fundamental model of the NHS. It's with this current government policy in relation to the NHS. So next slide, please. So just to summarise the 3 points again that were in the report, international benchmarking shows that the pre-underfunded NHS was the best model in the world. The principal cause of underperformance now is underfunding, and the properly funded NHS is sustainable for the long term. But a failed NHS, as we saw, will cripple the UK economy. So if you were, as I started out by asking you to imagine, if you were that rational policymaker, what would you do? Well, you would fund it in line with need, you would invest in poverty reduction, and you would invest in prevention. Thank you.